Hello, my name is Claire Godden and I'm the infant feeding lead midwife for University Hospital Southampton. This video is designed to give you some helpful tips to ensure if you're using a bottle to feed your baby, it is done safely and in a responsive way. Responsive feeding means responding to your baby's needs. This way of feeding supports their brain development. It's important to follow your baby's lead with how much to give and when, rather than set volumes at set times. So let's firstly have a look at when to offer a feed. When a baby is ready to feed, they will signal to you that they're ready by displaying feeding cues. Feeding cues can be waking up and stirring, opening their mouth and rooting for food, bringing their hands to their mouth and poking their tongue out. They may suck on their fists or blanket and make noises to alert you that they're ready for a feed. If they don't get a response to these cues, your baby will eventually cry and become distressed, which can make feeding difficult. So look out for the earlier cues of hunger and offer a feed before the crying stage if you can. When your baby shows you feeding cues, respond to them by picking them up and talking to them. Hold them close to your body and reassure them. This will help you both relax and help them to feel safe with you. It's also important with bottle feeding that you limit the number of people feeding them to only primary caregivers. This will reduce stress in your baby and help to build their brain and bond with you. Position your baby so they're sitting upright in your arm and ensure that you have good eye contact with them. This is essential for your baby's brain development and their happy hormones. Once you have prepared your bottle, gently place the teat onto your baby's upper lip. Wait for them to show you that they're ready. They will do this by opening their mouth and tipping their head back. Only put the teat in when they're ready. Keep the bottle in a horizontal position so that it's not tipped upwards during the feed. You want to ensure that there is just enough milk to cover the end of the teat without filling the whole teat with milk. By doing this, you are ensuring that your baby is drinking their milk in their own pace, which means your baby is less likely to feel overwhelmed with the fast flow of milk, and it will be more enjoyable for them. Keep watching your baby whilst they drink their milk, and never prop the bottle up under cushions or pillows, or leave your baby unattended during a feed, as this can be extremely dangerous. Maintain eye contact and ensure your baby is leading the way with how much they have. Your baby will want to have pauses during the feed, just like we would whilst drinking a big drink or a milkshake. Encourage frequent rests for your baby so they can digest their milk in a steady pace before continuing with their feed. Sometimes you need to encourage a break because your baby is drinking too fast. You can do this by lowering the bottle gently to bring the milk down from the teat. And you can do this as often as you need to ensure your baby doesn't drink the milk too fast. This will then help reduce wind and gas buildup after the feed, and it can also help reduce vomiting and reflux. Your baby will tell you when they're finished by showing you signs such as dribbling the milk out of their mouth, pushing the bottle teat out of their mouth, or pushing the bottle with their hand. And once they've had enough, never force them to finish the bottle. This can cause overfeeding. After the feed, keep them upright and close to you, giving them the opportunity to bring any air up by having a nice straight back. Make sure to get rid of any leftover milk and then feed your baby on the other side for the next feed if you can. Thanks for watching, and I hope you enjoy your feeding journey.